The European Health Report is an in-depth, comprehensive analysis of the health situation in the European region. And this year, for the first time, it charts our progress towards the targets of WHO Europe's overarching policy framework, Health 2020. In 2013, these 6 aspirational but realistic targets for health and well-being were set. The good news is that we're on track with the first target, reducing premature mortality from conditions like cancer, cardiovascular disease, chronic respiratory disease and diabetes. Infant mortality is declining too, and life expectancy as well as primary school enrollment are both improving across the region. There are still problems. Obesity is on the rise, and levels of alcohol and tobacco consumption in Europe are the highest in the world. There is an unacceptable gap between countries in relation to many health targets, life expectancy, for example. These so-called health inequities continue to be an important challenge for our region. But health isn't only about the absence of disease. The idea of well-being, which is at the core of WHO's definition of health, is becoming more and more important. But describing and measuring it is difficult. In our culturally diverse region, it can mean different things to different people. Vaccination, although it is the most effective way of preventing diseases like measles and polio, can sometimes conflict with deeply held cultural beliefs. Cultural practices can also have protective value, especially when it comes to well-being. Culture can help insulate communities against stress and hardships and so protect health. That's why WHO is continuing to help countries investigate new ways of exploring the cultural context of health. What have we learnt in making this report? That more and more countries are aligning their policies with Health 2020 and that those targets remain in sight. But there's more room for improvement. That collecting and reporting reliable evidence is vital, and we need new types of evidence for describing health in the 21st century. In fact, this may be the most important lesson we've learned from compiling this report. The better the evidence and health information that's collected, the more we can improve health and help both individuals and public health authorities make better informed decisions. And the more we can reduce inequities, the more we can make the aspirations of Health 2020 a reality.